I think the most important thing is that we're now a pathway. This is working across boundaries. So the old idea that you work in Trust X and maybe only care about what happens in Trust X is no longer the case, and that what you care about is the pathway across trust and across boundaries.
So over the last 10 months we've been developing in partnership, working with 14 trusts across North Central and North East London, how we're going to work together to provide and improve integrated cancer pathways for patients. What we are going to do is to unify, I guess, all the different trusts in our sector and create a seamless pathway essentially for patient care, so that there will be a uniformity of care across the network, and so that wherever patients enter it, they will get the standard uniform care, and it will be excellent care.
It's the patient care which is very much at the centre of our concerns.
The way that an integrated cancer system works is going to be very different from the way that they have previously worked.
We have a great problem to deal with, but we all can be involved with the solution to that problem.
Patients be treated in one particular trust for one part of their treatment and then another trust for another part of the treatment.
It means for the patient it can be a very confusing, very split up, very uncertain journey.
This is now much more of a team effort.
Whatever point in London Cancer a patient presents, that he or she will always have access to the very best care, will always have access to the latest clinical trials.
At all stages, a patient knows that they're well looked after.
So for patients treated in the London Cancer System, success is going to look like they're going to be diagnosed earlier, they're going to be much more informed about the treatment pathway that lies ahead of them, they're going to be have a much greater understanding of the benefits of taking part in clinical trials and research.
They will have an improved patient experience across the pathway, from the moment they get diagnosed, if you like, and before really.
They will be more satisfied with the outcomes they have, and the outcomes they have will be better.
Both in terms of their cancer survival and also improving their quality of life.
More equitable access to research, so more patients are enrolled in clinical trials.
And getting them back as close as possible to before they were diagnosed.
And all of this with good value for money.
This is an enormous opportunity for us to be truly world-class in the care that we can deliver for our patients.
We are finally working together for the benefit of patients, rather than necessarily working in competition with each other.
I think the key message is that this is actually a fantastic, probably a once-in-a-lifetime opportunity for us really to make a change in how we're doing things.
I think it's a really exciting time, and people should get involved.